Welcome to Pindar Poetry. We hope you learned something new.
You begin by assessing the goat right now. Note contraction rhythm and whether a water bag has broken. If active labor is present, make a clean, dry pen with fresh bedding. This reduces infection risk and eases delivery. Once done, wash your hands thoroughly and put on gloves because you will need direct contact. Make sure you have a bucket of warm water, 2 towels, lubricant, and a flashlight within reach so you can act immediately without leaving the dough. You now check the kid's presentation. Feel for 2 front feet with a nose between them or 2 hind feet for breech. If the head and feet are aligned, support the fetus and apply gentle traction only during the goat's contractions. Pull in a downward and outward arc to follow the birth canal. If you feel a malpresentation, use generous lubricant and, with steady hands, manipulate the limbs or head back into proper alignment. This reduces tearing and helps the dough push effectively. Once the kid is out, immediately clear the airway by wiping and suctioning nose and mouth. Rub vigorously to stimulate breathing. Tie or clamp the umbilicus 2 to 4 centimeters from the body and dip it in iodine to prevent infection. Make sure the dough is comfortable and encourage bonding and nursing. Watch for the next kid. If labor stalls for more than 30 minutes between fetuses, there's heavy bleeding, or you cannot correct a malpresentation, call your veterinarian right away for assistance.
Thanks for watching. Consider subscribing if we helped you.